Coming up, our Ask the Expert segment. Dr. Corey Russell's here to answer your foot and ankle questions. You can pick up the phone, call him up next. Your feet and ankles are our topic today on Ask the Expert. Dr. Corey Russell joins us now with the answers to your questions. Good morning.
Good morning.
All right, first question. Someone has a son who's been diagnosed with warts. What causes warts and how can they be prevented?
Well, Tony, warts are caused by a virus that gets in the skin. Most commonly, you see this in children. It's usually picked up in showers, around pools, in a warm, moist environment. And what happens, that virus gets in the skin and leads to these lesions, which sometimes are painful, usually on the bottom of the foot. Treatment for it, well, topical medications are used. Sometimes we use a laser or freezing treatments with liquid nitrogen to kill that virus and then obviously kill the wart. Prevention is key. To prevent it, keep the feet cool and dry. And by doing that, you spray shoes and showers with Lysol. You wash your shoes, try to keep them dry. If they've been saturated in water, you can wash them or replace them. Hopefully it's the virus that's growing in the shoe you can get rid of and not reinfect yourself.
Gotcha. In the shoe, so that's a good place to
Absolutely.
go. I've never considered that. It might be still in the shoe. All right, you keep getting an ingrown toenail, this person says, and it keeps happening on that person's big toe. So how can you prevent an ingrown toenail from coming back?
Well, something we see obviously very commonly in the office is a common problem. Ingrown toenails, people try to trim them at home. They do a little bathroom surgery to see if they can get rid of the ingrown nail border, and typically it doesn't work too well. So what do you do to prevent it? Well, there's not a lot you can do necessarily to prevent the ingrown toenail. People are just predisposed to it. So treatment sometimes in the office, what we do is take the side of that nail out and put a little chemical on the root so it doesn't regrow. That way you don't have to deal with the problem anymore. And it's a very simple procedure. It takes about 10 to 15 minutes in the office. Sometimes we treat those with antibiotics as well as they can become infected.
All right, and then we had another person who said that he or she gets an itchy rash in between their toes. Now, does that sound like athlete's foot, and what can this person do?
It sounds like athlete's foot, Tony. Yeah, this is something you see more commonly in the warmer months. Obviously, the shoes, once again, it's a warm, moist environment. It holds that perspiration around the foot, and that fungus that grows can grow in between the toes, grows on the skin, and you get an athlete's foot infection, which is a fungal infection. So treatment consists of antifungal creams or gels, usually for treatment in between the toes. Once again, prevention, similar to warts, is to keep the feet cool and dry. Spray shoes and showers with Lysol to kill the fungus there. Rotate the shoes, or if the shoes once again become saturated in water, probably replacing them is a good idea.
All right. Hey, this next question reminds me of my mom. She may have broken her toe a couple of weeks ago, but she wasn't sure. And this person is wondering, is it true that there's no treatment for a broken toe?
No, that's not actually true. We get that a lot in the office. People say they stubbed their toe or whatnot. They come in and say, well, I didn't think there was anything really I could do for it, but it's hurting. Well, there actually is treatment. What we typically do for any patient that comes in with what they think is a broken toe, obviously we get x-rays first to confirm that. If it truly is broken, it depends on the severity of the break. Sometimes it's severe to the point where it requires surgery to fix it, to realign it. If that's not the case and it's not a very bad break, usually we'll put those patients in a surgical shoe, like a hard-soled shoe, to prevent them from bending the toe, and also we'll show them how to buddy splint the toe to prevent it from bending. Those things really help to reduce the pain and allow the broken toe to heal quicker.
Right, and that's basically what we told her, was tape your toes together is what we've heard, and I didn't mean to laugh, but she wasn't about to do anything about it. So, you know, sometimes you got to get after people, say, hey, go ask the expert here, talk to
That's
Dr.
exactly
Corey
right.
Russell. All right, thanks very much for joining us this week.
Thank you.
Appreciate it. Hey, stay right there, we got another